effects on mental. The major indirect effects are the lockdown situations, which reduce the social contacts and may lead to isolation. It may also be an influencing factor, the reduced economic output and loss of jobs and reduced medical care. And on the other hand, the specific effects on mental health are some not very typical, but also possible neurological and psychiatric results of the virus infection directly, but also influences of these indirect effects on patients with pre-existing mental disorders or people who are at risk to emerge mental health problems newly. The relatives of patients can be involved and the medical staff can also be involved. Lockdown in Germany, which is my focus of the lecture in Germany. We had 3 phases of lockdown. The first lockdown in March 2020 to May 2020. Then again, after the summer, in the autumn, lockdown light from November 2020, and then the second lockdown over several months from January 2021 to May 2021. And the lockdowns included the closure of schools, which was not very simple for many children to have not the direct contact to their to the other pupils, but also the difficulties in using the system with digitization and digital media was not very perfect in the schools. So there was a loss of communication, but also impaired learning. There was only for children in low age and emergency care in the kindergartens. The private contacts had to be reduced. Maximum were 5 people from 2 households. And you had only the permission to leave your own home for good reasons, for necessary shopping, going to authorities, visiting your doctor, caring for relatives, walking the dog, some sporting activities, but not in the group. And many shops were closed. And the picture there shows Berlin in December 2020. It seems like a ghost city without any living people there, only the buildings can be seen. The incidence of new infections seemed during the first lockdown to go down, which was from March to May 2020. And you see here from the incidence, low incidence numbers compared to the incidence numbers today between 500 and 1,000 in Germany. And here only 200 as a maximum in red. And it seemed as if the first lockdown has an effect. But if you see the second lockdown, it's questionable whether this restrictive lockdown has the effect we expected. But it was the first idea what can be done to reduce the spreading of the virus. And maybe the result is that using a mask, like the influenza epidemia in 1920, using the mask is one of the most important instruments to reduce the spreading, and also that people who have symptoms or have contact to persons who have the virus reduce their own social contact, and not only the global lockdown. Here the death rates are demonstrated that it was relatively low, but the number was low, but 3% of deaths during the first wave. Here in gray, the COVID-19 deaths from the RKI Institute. The second wave had only 0.9% of deaths, but the number was much higher. In the third wave, also 1% of the deaths. And we had a significant higher death incidence of elderly women during the first and second wave. Nobody knows exactly why. You see here that women also beginning with 55 to 59 years and with a maximum here at 80 years. A lot of numbers here, and it's a study investigated from pathologists, but this is here, the majority is female, and in the third wave, it's more are more male tests than female. The question which arises is the death from COVID-19 or with COVID-19? And there was a significant change between the first, second wave, and then the third wave. And the discussion goes in the direction that the major influence was the change in the structure of the virus from Delta variant to Omicron variant. And you see here in Germany, during the third wave here, 16% were Omicron associated, were dying with COVID and not because of COVID. And in Denmark, the percentage was much higher. So the theory is that the danger of the virus itself was reduced with Omicron, but not the death rate, because people which are somatically ill can also have an additional effect because of the virus. And if you look at the old people, there is a study from the greatest health insurance in Germany, the AOK, and they investigated through the three waves the mortality rates in retirement homes. And you see there highly significant difference between residents without admission in hospital from people from a retirement home, if they are sent to the hospital with any disease which needs inward treatment, then the death rate is nearly 10%. And during these COVID-19 waves, residents with COVID-19 infection, when hospitalized, had more than 50% deaths, which was a very high number. And many retirement homes had the tendency not to send their their residents to the clinic because they feared that they could infect in the hospital with COVID-19 in these waves. But the number was very high of people who in the higher age who were at risk to die. Here are some details. Residents with renal insufficiency, dementia, blood cancer, immunosuppressive therapies, or previous organ transplantation had a particularly high risk of death. The risk of dying was higher for men than for women. And the losers of the pandemic were the elderly and those in need of care in their homes. And so the people concluded, as Professor Brunner from Charité, as a project manager of this study, that it is an ethical task to draw lessons from the results for the future design of care in the care facilities. Very important suggestion, but not realized at the moment, because the care facilities are not really prepared for isolation of infected residents or infected patients, and there has to be done a lot to change this situation for future pandemics, I think. And they concluded also that protecting these people through vaccination remains particularly important. This was not the case at the beginning of the wave, and when the vaccination started, there were some retirement homes where the patients waited for vaccination, and further other people from medical staff, but also politicians and others were vaccinated. This was not a good distribution of the vaccination, and the vaccination status of nurses also is important in such resident homes to avoid or to reduce the risk of spreading the virus. The World Health Organization has started an action, living with the times, they call it, a mental health and psychosocial support toolkit for older adults during the COVID-19 pandemic. They painted, generated such pictures here, living with the times, and this activity toolkit is specifically focused on older adults, on how to protect their health and well-being. I think with the idea that not only the psychiatrists and psychologists are there to organize and to solve the problems which are generated by the COVID-19 pandemic. And they have focused this on simple questions, and I think understandable also for people, relatives who want to help or have a basic knowledge of such psychiatric or psychological problems. And they made 5 large posters. I will show only one. 2 questions like, how can I stay healthy? What can I do to improve my mood? How can I feel connected to my family and community? Where can I get help if I need it? And how can I cope with grief and loss? And one of these posters is a grief and loss poster. And I don't know whether this picture helps really, but the questions are important, or the suggestions are important. Remembering happy moments and time spent with a deceased person, maintaining daily routines while thinking of and remembering the deceased person, because many people who lost their relative are not informed, or they have no idea what to do with their grief and how to behave. And so it might be helpful to give them some suggestions not to forget the lost person first, or not to think about it because they get grief and depression again, but to have a cognitive process and an emotional process to live with this situation. Talking about happy moments and memories of time spent with a deceased family member, photo album, talking about happy moments with the times with the memories. It's the same. Visiting a community or religious or spiritual leader, walking in nature, or looking at photos on a computer or phone. This is an example what can be done in such cases, and also a suggestion for relatives what to do in this situation. The World Health Organization made also a wake-up call to all countries to step up mental health services and support in March 2022. They found that the pandemic triggers 25% increase in prevalence of anxiety and depression worldwide. And there are several possible explanations for this increase. The first idea is that unprecedented stress caused by the social isolation, maybe from lockdowns, but also from social distancing resulting from the pandemic, triggers anxiety and depression. Then the constraint on people's ability to work or seeking support from loved ones, and the engagement in their communities, which was markedly reduced. Then the loneliness, fear of infection, suffering, and death for oneself or for loved ones, grief after bereavement, and financial worries, which were also cited as stressors. And among health workers, exhaustion has been a major trigger for suicidal thinking. This is not so really true as it was believed initially. So some words about suicidal thinking later. Before, I would like to mention this COVE social project supported by the Max Planck Gesellschaft, where the participants from Berlin were recruited and were investigated and observed during the pandemic. The participants, which were found, had a very high number of depressive disorder in their anamnesis, 40%, something like that, anxiety, nearly 20%. And they had different phases. Contacted were 56,000 Berliners, 70,600 were included, 3,500 made the first 3 measurements, and 1,200 finished the study, very high numbers. And they found also indicators of depressiveness, anxiety, loneliness, and stress, which increased during the first lockdown, declined during the reopening period in summer 2020, and then increased again at the beginning of the second lockdown, which is presented here in detail. As I mentioned, these participants have pre-existing depression in part and anxiety, and they started during the first wave. There was an increase in depressiveness, went down, but increased again more and more during the second lockdown. So you can conclude that lockdown is not good for people which are at risk for depression. Also loneliness, which might be associated with depressiveness, stress a little bit lower, and anxiety was the same increase as during the first wave. So the conclusion is that depressiveness is a very great problem, and activities of the mental health system should be focused on this group of patients which have the risk to become depressive or to get so-called burnout syndrome if they are working and the work increases, especially in the mental health worker system. The idea major trigger for suicidal thinking, I would like to say some words about. There were a lot of publications which warned the world to prepare using phrases such a tsunami of suicide. And this is one of the examples in psychiatry research in 2020, where the authors projected an increase in suicide in Canada as a consequence of COVID-19. And they calculated in a time trend regression analysis and used the unemployment rates, postulated that the unemployment rates will increase during the pandemic, and then they calculated three different risks in the suicidality, suicide mortality, because there is an association between unemployment rate and suicide mortality. But unemployment is not the primary reason for all people to become suicidal or to get or to realize suicide. And so it is interesting that Professor Tanten in Asian Journal of Psychiatry in 2021 wrote an editorial COVID-19 and suicide, just the facts, key learnings and guidance for action. And here he wanted to clarify, because of a letter I will show you afterwards, which was written to him and the journal. And he stated here, a majority of such comprehensive database studies report a modest reduction in total suicide rates, not an increase. And the remaining reports had no significant net increase in suicide rates. He also states that whereas a net decline or no change in overall suicide rates was evident in the data presented in these reports, that observation was not mentioned in the abstract or conclusions of many of these articles. And before, there was a letter written from the International COVID-19 Suicide Prevention Research Collaboration, and they from 39 countries, which an internal group of suicide prevention researchers, and they wrote, we have recently noticed an increasing number of publications related to suicide and the COVID-19 pandemic being published in your journal. They were delighted that Asian Journal of Psychiatry has been able to prioritize and rapidly publish articles related to the impact of the pandemic. However, the titles and the content of some articles had given them some cause for concern, and concerning aspects of reporting included description of suicide methods, sensational headlines, and excessive reporting. And they warned that these can lead to suicidal behavior among vulnerable people. And so I would like to present only shortly these guidelines, which are there for publications and also communications in the public about suicide. And they wrote here to Professor Tanten, remove references to methods or suicide from article titles and avoid detailed description of methods in the body of the article, e.g. how a ligature was attached if somebody kills himself. descriptions of a novel method of suicide should be avoided. Then avoid speculation about triggers or cause of suicide, in this case COVID-19, and its associated public health measures. Suicide is extremely complex, and the problem is that the press will use such articles and will present it as headline for all people who become anxious or suicidal, people who are in danger to realize something like that. The recommendation is to avoid sensational language such as surge, spike, crisis, tsunami, and epidemic when describing the potential impact of the pandemic, and particular care should be taken when referring to suicidal behavior in young people, as this group is particularly susceptible to suicide contagion. This is well known, and so many newspapers and media reduced the reports on detailed suicide, e.g. if there's somebody jumping before a train, and it has been shown that this reduction of suicide reports substantially and significantly reduces also comparable suicidal behavior of people who are at risk. And so it's interesting that on a high level, this collaboration wants on a high level other publication papers to see these problems. The workers in healthcare are not in a maximum risk for suicidality, but they have very great mental problems. And this is a survey from the Mental Health America, collected from more than 1,000 healthcare workers, and these responses indicate that nearly all have experiencing more stress, but also the high number, 86% experiencing anxiety, 77% frustration, 76% exhaustion and burnout. 3/4 of these, this is a very high number, and 75% said they were overwhelmed. This is not good. And also there are problems in the families of healthcare workers with children. They were worried about exposing their child. They feared that they could bring the disease from the hospital home. Nearly half were worried about exposing their spouse or partner, and also exposing their older adult family members. It's not simple. It was not simple to go to the hospital and to have their cases of COVID-19. And then you don't know whether you might be infected, and you have old relatives, and the danger is that you could infect them. Emotional exhaustion, also somatic symptoms like changes in appetite, physical symptoms like headache or stomachache, questioning career paths, compassion fatigue, and many things more. And they did not feel like they had adequate emotional support. People with children, the half reported they are lacking quality time or are unable to support their children or to be a present parent. And so you see some trends and results of this situation. Here is the number of ICU beds. In Germany, we had a very high number of ICU beds here, with 30,000 at the beginning of the pandemic. And this is here, the number 20,000 were with patients and 10,000 were free. And then you see stepwise going down the number of free beds in the intensive care units, in the ICUs. And at the end of this process, we have 30%, more than 10,000 free beds, 10,000 beds lower the number than before. And the Germany-wide survey by the Ali Salomon Hochschule Berlin in January 2022 states that lots of overtime, what people working in the health system say, lots of overtime, too few staff, high risk of infection. The burden on nurses has increased significantly during the Corona pandemic. 40% of nurses in Germany are now considering changing careers. This is not a good developing problem. And looking yet now again to the hospitals and to psychiatric patients, we also made in Vitos, which is a concern who treats 1/2 of the psychiatric patients in Hesse in Germany. We analyzed at the first step the number of admissions to hospital during the year 2020. And we found a substantial reduction during the lockdown, which was a result of the political advices to take only patients with emergency and not to admit patients to the hospital which are elective patients. This was not necessarily it was not necessary, but the idea was that if we get a very great number of patients with COVID-19, that the psychiatry should reserve a substantial proportion of their beds for COVID-19 patients or for psychiatric patients, and to change another psychiatry from psychiatry to somatic medicine and to position the COVID-19 patients there. So we reduced the number of elective admissions, and the severity of the patients became more severe because the patients who had lower intensity of symptoms were not in the hospital. And this was different, was in all groups with all diagnostic groups, but there was a markedly different influence of the diagnosis. And if you look at this for diagnosis groups from ICD-10, F1 is drug-induced disturbances, alcohol dependency, drug dependency. F2 is schizophrenia and psychosis. F0 and G3 are organic disorders, mainly dementia. And F3 are the affective disorders, depression and bipolar disorder, mania. You see during 2020, you see during the first lockdown, that there is in March and April going down the number of admissions. And you had, for example, for all 10 Vitos clinics, you had in January 800 drug-associated and alcohol-associated admissions per month. The whole year, something like 10,000. And here it's going down to less than maybe 350. And then after the lockdown, the numbers go back, but you see that the major effect is here in the drug and alcohol dependency group. It's staying 20% lower than before. This might be an effect because we did not take these patients with drug dependency. And the doctors in the practice, in the outpatient department, had something to do. And what did they do? They gave the patients substitutes, benzodiazepines and other substituting drugs. And the motivation of the patients to make an admission in the clinic was substantially reduced because they got now medications which were before forbidden for people with drug dependency. And the result, here some information only about our clinic. We have alcohol addiction, 20 beds with 800 cases a year. We have drug addiction, 20 beds with 300 cases. And we have for drug addiction, trauma-associated disease also 14 beds. Altogether, maybe 1,400 patients with dependency diagnosis. And these patients, we are responsible for the Hochtaunus crisis here, which is in the north from Frankfurt am Main, but all these drug-dependent patients are coming from Frankfurt. And we lowered this patient admissions from Frankfurt. And the result in June 2020, but the situation did not change up to today. Here the title of the newspaper is Frankfurt Central Station District. Danger in the district is growing. And here translated to English, the city of Frankfurt is waiting for British bankers and Fashion Week and is letting their entree to go to waste. Drugs and garbage dominate the cityscape. Things are bad around the train station district. what does not mean that totally Frankfurt is this way, only a few places, but in the central, near the central station. And it is described in colorful described in times of the deepest lockdown, when the Frankfurt train station district seemed deserted. There were scenes that local residents say look like something out of an end of the world movie. People staggered across the street in a drug frenzy, only half conscious. Screams could be heard again and again, day and night. Once a man scurried across the sidewalk on Taunusstraße. He had put the syringe in the middle of his face. Larger groups of other addicts sat on the sidewalk, and so on. It's a great problem, and the problem is unresolved up to today, and the problem is increasing. Maybe because of the substitution, the number of patients is a little bit lower than before, but the problem of drug addiction is there, and there's no clear solution what to do. Finally, long COVID conditions. This is a problem. On one hand, everybody knows that there is something like post-COVID, and there are several different definitions. Some people who have been infected with the virus that causes COVID-19 can experience long-term effect from their infection, known as post-COVID conditions or long COVID. And many names: post-acute COVID-19, post-acute sequela of SARS-CoV-2 infection, long-term effects, and so on, chronic COVID. And there are some symptoms, or several symptoms, which include also mental health. And this is tiredness or fatigue that interferes with daily life. That can also be symptoms that get worse after physical or mental effort, which I know also several patients who say that at the first moment they have a mental effort, have to solve something, they have to make mathematical calculation, also pupils in the school, they can do this. But if they have to do a lot of such work, then they get worse, and they cannot explain why they become tired, or they get headache, or they have concentration difficulties. And neurological symptoms also, maybe also psychiatric difficulty in thinking or concentrating, sometimes referred to as brain fog. Sleep problems also not rare in such patients, and depression or anxiety. It is not really clear where these problems come from. One reason might be that during the acute infection, there is a disturbance of the vascular system, brain vascular system, and inflammation. But other findings suggest in animal studies that the virus is going through the nose and into the brain, and that typically certain regions of the memory region in the hippocampus and the and cells within the campus, which are memory cells and which are generated by neurogenesis, are impaired, which might explain some typical symptoms we have also found in our special ambulance outpatient department, where we have patients who were highly intellectually and from their memory able to do things. And after COVID-19, they had a loss of these abilities, had a loss to memorize simple, complex working things, and could not work anymore. In the age of 45 years or 50 years old, 20 years with very excellent ability to have excellent memory, which was substantially impaired months later. Nobody knows exactly what the reason is. And a great problem, and I think also a topic for awareness, is not to say these people have had before another disease. And this is only, we don't know why these symptoms are produced. And so we think it must be another disease. And it's very difficult for these people to convince others, because if you talk to them, they seem to be normal, but they describe typically these symptoms that get worse after mental or physical effort, and which was not as before, and which started with COVID-19. And after COVID-19, in some cases, 2 to 3 weeks after COVID-19, and maybe then they recognize that there was something they did not find before. There are also studies in children which suggest that the virus is in some children longer, over weeks, persistent than expected, but the causal relationship is not solved. I think it's important to look at these people, to believe and have to make a very exact registration of their symptoms before and after, not to say simply this must be anything else, we don't know the reason, and so you have nothing, because this is of great consequence for the people who have such symptoms of long COVID. Here is a very interesting publication in Nature Medicine from 1 week ago, and they investigated a cohort of 5,000 uninfected people and 154,000 patients infected over 1 year. And it is very clear that symptoms like cognition and memory disorders are significantly higher in patients who were infected, and also mental health disorders. And this needs further investigation. What is a mechanism? How can we collect objective data or test this functions also in memory, so that we can accept that there are post-acute neurological disorders, as called here, but also psychiatric or psychological impairments in patients with COVID-19. So I come to my summary. Opportunities and risks for psychiatry. Opportunities are there. There was a substantial change in psychiatric treatment strategies. The introduction of video consultations into psychiatric and psychotherapeutic outpatient treatment. The insurance companies at first were not very pleased about this idea, but then they accepted it. Maybe they feared that the doctor will not work and only use his video camera and talk a little bit to the patient, but this is a very useful way to communicate with patients who are at home, not only for COVID-19 patients, and not because of the lockdown, but also patients who have a wide way to the hospital, and patients who need contact several times per week, and to have a communication with the therapist. And there's also a change in the hospitals. The pandemic is activating the digital documentation, online tutorials and lectures, home office in hospital administration, and in part for therapeutic staff, messenger communication with patients. And if we have the glass fiber communication possibilities in Germany, which are not finished today, and the reduction of hospitalizations and the increase of home treatment are positive opportunities, which are strengthened by this situation. On the other hand, there's a lot of awareness necessary. There's a demographic change in industrialized countries. And so more than at the moment, concepts for prevention and treatment of mental problems in old age are needed. And I think this is not seen in the necessary way at the moment. And this is not only depending from a pandemic, but this is a general problem which should be solved. Then it is important to identify and help people with post-traumatic symptoms. Must not be PTSD as post-traumatic stress disorder, but the loss of relatives and the grief. And the way to manage this situation might be very important for the patients, for the people, but also for the society, because it has a risk that they reduce their ability to work in the society after such experiences. Then the nursing staff, especially, and medical professionals, need sustained support in times of crisis, which was a little bit missing during the pandemic. At the beginning, you see then ministry and politicians in the media saying and thanking the nurses for the great work they are doing, but when it is discussed whether they get some more money and substantial more money, then the sums are relatively low, and they not only need money, but they also need support with their children and support in their family because of the risk that they can infect their family. They need social help or social support, and they must have somebody where they can go if they have beginning burnout syndrome, depression, anxiety. For people with drug addiction, forward-looking concepts are needed, as the Central Railway Station in Frankfurt illustrates. Then effective implementations of digital treatment options and urgently needed in psychotherapy and psychiatry. And in future crises, the needs of people with existing or impending mental health problems should be considered from the outset, not afterwards 2 years later in an examination or study. Ukraine war and its economic implications can be seen, in my view, as the next challenge for the population, for people who lost their job, who have not enough money to pay their energy prices and something like that. So I thank you for your attention, and will now finish my presentation. And if you have some questions, I would like to answer them. Thank you.